What are the psychiatric manifestations of chronic alcohol abuse? So let's think about a patient. Imagine a patient who has just taken alcohol, a huge amount of alcohol, and obviously this results in slurring of speech, slurred speech. And oftentimes we see the patient become aggressive and have fights in the street. So they become aggressive. Slurred speech and being aggressive, the common manifestations of alcohol abuse. And if the patient has taken large amount, this can lead to something called an alcoholic blackout. You just can black out. And patients often can have something called an alcoholic hallucination. Those are classic features. Alcoholic blackout, alcoholic hallucination. Also features of chronic alcohol abuse and also present in acute alcohol abuse. Slurred speech, aggressiveness, blackouts, hallucination. And if someone persists taking alcohol again and again and again, they may become depressed. And some of them may become manic. So depression and mania can develop in patients who have chronic alcohol abuse. What are the other manifestations? In some patients, there can be deficiency of vitamin B1, and that leads to two syndromes. First is a Wernicke encephalopathy, Wernicke's encephalopathy. And the name suggests encephalopathy, meaning there will be disturbance of the brain and nervous system function. Usually, those patients develop the classic features of brain damage. If there is brain damage, the patient becomes confused. There is confusion. There is often ataxia and dysfunction of the extraocular muscles leading to ophthalmoplegia, confusion, ataxia, and ophthalmoplegia. And whenever there is ophthalmoplegia, there can also be nystagmus on the clinical examination. So those are the features of Wernicke's encephalopathy. And some patients may develop what is known as the Corsac of Psychosis. This is an advanced version of the Wernicke encephalopathy, where features of Wernicke encephalopathy may be present, and along with those, the patient will also have the memory deficits, and that's why the patient will develop confabulation. The patient will try to make up stories, imaginary stories which are not real. They will lose their short-term memory and they will try to make some fables. This is known as confabulation. And this suggests something called the Corsac of Psychosis. Corsac of Psychosis. This is the most severe version of the vitamin B1 deficiency, and usually this is irreversible. But Wernicke's encephalopathy may be reversible with treatment of B1 or Prabirnex. If you give B1 injection, the patient often come back to normal. So those are the psychiatric manifestations of alcohol abuse, starting from the slurred speech, being aggressive, having blackouts, hallucinations, then developing depression or mania. And due to deficiency of vitamin B1, patients developing Wernicke encephalopathy, confusion, ataxia, ophthalmoplegia, and nystagmus. Persistent vitamin B1 deficiency resulting in memory loss, presenting as confabulation, known as Corsac of Psychosis.